Good morning. Can you hear me?
Yes, we can.
Okay. First of all, I want to say good morning, and I have a small introduction. If you give me 1 second, I'm sorry, I'm not the most. I promise you, I just had it. So, good morning. My name is Jocelyn Sell. I am an officer in Mount Rainier Police Department. I work under Chief Alston. Today, I have the pleasure to introduce Ms. Diana Varela. She's a public affairs specialist with the Social Security Administration. She's here to facilitate our first workshop, Social Security 101. This is the first of 3 informational workshops the City of Mount Rainier Police Department is organizing in a way to emphasize our theme of caring for our community. And I want to thank you, Ms. Varela, for facilitating this for us, and you too, Ms. Diaz, and everybody who helped us get it together.
Okay. Ms. Ellis, thank you very much. Actually, on behalf of the Social Security Administration, I would like to say thank you to the City of Mount Rainier for inviting us to provide information to community residents about Social Security benefits. I personally would like to say thank you to Ms. Diaz, who was the person who reached out to us. And I also had a meeting with Mr. Brian Fryer, correct?
Yes.
I pronounced his name correctly.
Mr. Fryer, yes.
And thank you to Chief Alston for allowing his employees to reach out to us for hosting this program. It is a pleasure to be with you this morning, okay? And I'm hoping that the information that I will provide to you is going to be very useful, and we will have plenty of time for answers. I know you have questions, so thank you so much.
Thank you. I just have a question though. Before, I'm so sorry. My name is Pink, and I am working for the City of Mount Rainier Communications Department. And I am just wondering why we have several attendees right now that are named Pink Howell. So I'm not sure what's going on with why is it registering as my name. I sent the invitation, but I'm not sure what's happening.
Pink, Chief Austin here. They may have to go in as I did on their screen up to the 3 dots to the far right top and click on rename, and they can put their names in at that point. And I see exactly what when I came in, I was Pink Howell as well.
I saw that. I'm like, oh no, that's not me. I'm not signing in as multiple. So if we can have our guests, our attendees to just change her name, that would be great, so then we can actually acknowledge you as well for being here. And thank you, Miss Varela, too.
Yes. Oh, you're welcome. I thought that you had discovered the power of multiplying yourself. So I said, I need to talk to her so we can do more.
I did not do. I sent the invitation, but I'm not sure why it did that.
Okay, great. Well, thank you very much once again. And let us know, Ms. Diaz, when you would like for us to start. And I really appreciate you not only reaching out to me, but also to conduct the presentation with me today, because you will be my right hand clicking on those slides, Ms. Diaz. So I really, really appreciate everything. And it's been a pleasure working with you so far. So, and I know that we will work together for a long, long time, for as long as I am in Social Security, okay? Let me know when you want me to start, please.
There you go. Okay, Ms. Varela, please start. The PowerPoint is already up.
Sure. Okay, great. Thank you so much. And I will tell you when to advance to the next slide. Once again, thank you very much for inviting me. Thank all of you for attending this program. As Ms. Ellis and Ms. Diaz said, my name is Ms. Varela, Diana Varela. I work out of the Silver Spring Social Security office, but I actually work in communications. I actually work in the Washington, D.C. area. We have 14 offices, and I have been working for the administration for 26 years. Most of my career, I have worked in outreach in the community. So it is my pleasure to be with you this morning. Thank you very much for attending. And since we have a series of 3 programs in the community, Ms. Diaz reached out to us, and she wanted to get more information to everybody in the community. And since everybody has different needs of information in regards to their Social Security benefits, we thought about with the beginning program to provide benefits to people that are already receiving Social Security benefits. So if just now you're not receiving any Social Security benefits,
so
I know that this
information. That's from the person who sent the invite out. A number of us were named.
Can you please unmute yourself?
Said I could rename. Oh, couldn't do it.
If you are in the meeting, so please unmute yourself. Thank you. So the information that I will provide to you really is for people that are already getting benefits, but I am sure that you can use the information for a relative, for a friend that is already getting benefits. So thank you once again. And the first thing that I would like to let you know is how to contact the Social Security Administration, how to conduct businesses with us. In the next slide, you will see that there are 2 ways to contact Social Security. First of all, the best way to conduct businesses with us is visiting our website, ssa.gov. In our website, you can, if you're not getting benefits yet, just in case, for those of you who are not getting benefits, we have publications, we have tools, calculators, benefit planners that will allow you to get the information you need. We have a fantastic frequently asked questions. Any questions that you have about any of our benefits can be answered through that section. So we have a lot of tools and information that you can get what you need. Also, if you are getting Social Security benefits, then you can really do many business with us online. If by any chance you cannot finish your business with us online, please give us a call. Our representatives at the toll-free number 1-800-772-1213 are available to answer your questions from Monday through Friday from 8 a.m. to 7 p.m. And, of course, we have one more option to contact us. You can actually call your local office. If you take a look at the top of the screen, this is actually a screenshot of our web page. And if you take a look at the menu, if you click on menu, you will have an option, and you will have like a drop-down box towards your left, and then you will have the option to select Contact Us. Once you open the page on Contact Us, at the bottom of the page, you will see the office locator. Once you click on Office Locator, you can give us your zip code, and we will provide you with your local office phone number. So please visit us online, give us a call at the toll-free number, or call your local office. And in the next slide, what I would like to invite you also is to create an online account, because the online account is really the gateway of conducting businesses with us, either if you receive benefits or not. If you don't receive benefits yet, then you can get information. You can take a look at your earnings record. You can actually look at the benefits, the different benefits that you qualify for. And more importantly, you will be able to see the amount of benefits that we can pay to you or to your family in the future. So please create your online account. And for those of you receiving benefits already, that's the way that you can get information from your record. If you need to have like a benefit letter to prove your income, you can get it through your online account. Also, if you need to make a change of address, if you need to make a change on direct deposit information, you can do that online. Tax season is here, right? If by any chance you misplace your 1099, that is one of the documents that you can get online. You can even request a replacement Social Security card if you are a U.S. citizen. So please try to create your online account, because certainly it's the best way to conduct businesses with us. At this time, I would like to stop. And what I would like to do is ask if you have any questions on material we covered so far. And I'm going to be stopping from time to time. So instead of being a presentation, you and I have a conversation about Social Security. So far, we have discussed how to contact Social Security and my Social Security online account. Do anybody have any questions about those two topics that we have discussed so far? And I think that you can unmute yourself and then please put mute back once you're done with your question. Or you can type your question in the chat, please. Anybody has any questions on what we covered so far?
Hi, I put my question in the chat, but it was just to ask if you're going to record, if this is going to be recorded so that we can just concentrate on everything you say without having to be distracted and taking notes.
I understand. And I will defer that question to maybe Ms. Diaz or Ms. Salas. If you can let us know, please, if you are recording these presentations.
Yes, it'll be recorded.
Okay, that's the answer. Okay, awesome. Thank you. So you will have these available. And please just remember that the amounts that you saw at the beginning of the presentation, the amounts that we are going to discuss, if in any case any amounts, are only effective for the year 2022. Okay, so if you don't have any other questions, let's go to the next slide. Okay, and please remember that I will be stopping from time to time to ask if you have any questions. You can send them through the chat or you can unmute yourself. Now, reporting responsibilities. What are reporting responsibilities? Well, everybody that receives Social Security benefits, we can do a review from time to time for different reasons. For a person that is receiving disability benefits, we are going to do reviews to make sure that the person is still disabled on the Social Security laws so we can continue paying benefits. For people that are older, we have to do reviews just to make sure that they are doing well, that they are still able to manage their benefits, that they are not due to receive other benefits, and therefore that is why we do reviews. It is very important that you fulfill your reporting responsibilities with us, because the most important reporting responsibility that you have is to notify us about changes of address, including moving outside the United States. We pay benefits out of the United States. And there are different regulations for different countries. So it is important that for you to continue receiving your benefits even out of the country, you provide us with your address. A lot of times people say, hey, I have direct deposit. Yeah, you send me my benefits to my bank account. And it's okay. People move from one place to another. They don't let us know. And if somebody is due a review, and we do that randomly, okay, then we can find the person because they have moved and they didn't provide us with information about new address. And that represents an issue with the payment of the benefits. So please, if you receive Social Security benefits, please let us know about changes of address, direct deposit, phone number. We will try to reach you by phone. We will send you a letter. And I know that nowadays it's very important that you be aware that there are some scams, okay? We'll talk about that in just a minute, but just be aware that, yes, it is possible that a Social Security representative will send you a letter because we are doing a review, and that we will call you and ask you for personal information. Other things that you have to report is if you started to work. If you can work. We allow Social Security beneficiaries to work. Happen to be that dependent on the type of benefits, we will allow you to make certain amount of money. If you are receiving supplemental security income, known as SSI for short, you have more responsibilities. You have to report any changes to us because a lot of times those changes will impact the eligibility for you to continue receiving your SSI benefits. So please, if you receive Social Security benefits, if you know somebody that receives Social Security benefits, let them know they need to report to us any changes. Now, I talk about, hey, a Social Security representative can call you and ask you questions, personal questions. In most cases, we will send you a letter first and schedule a telephone appointment. But be aware there are scams. In the next slide, I would like to provide basic information on the scams. There is especially one scam, next slide please, in which somebody will call you and say that they are calling from the Social Security Administration. Sometimes there are reports of cases in which these scammers actually have mimicked the phone number, the toll-free number, or other numbers from the Social Security Administration, and they might go in our website and get the names of some employees, and they will call you. Hey, this is Diana Varela calling you. My name is my contact information is in our website. So they might get all of this information to try to convince you that they really work for the Social Security Administration. There is a big difference between these scammers and a Social Security employee. First of all, as I said before, we will send you a letter. We will tell you that you have an appointment, okay? You can always call us back to verify that that is indeed a true review. These scammers will not be able to provide that to you. These scammers will also tell you that you are going to be arrested because there is a warrant for your arrest, that the sheriff is going to come to arrest you if you don't pay a certain amount of money, if you don't send them a gift card, if you don't do a money transfer. They will threaten you and they will ask you for money or a gift card. One of the representatives for the Social Security Administration will never do that to you, will never ask you for money or a gift card. So please be aware. And there are, a few tips that we would like to provide to you in the next slide so you can protect yourself. Okay. First of all, understand that there are threats. And these threats can come either by phone, somebody can call you, or these threats can come by mail, or even there are some few reports, okay, but there are reports of people trying to actually knock on your door and try to be in person trying to help you. So please be aware, these threats are real. Yeah, and be cautious about it. Be cautious and secure your personal information. Unless you know for sure that you are talking to a Social Security employee, never provide your personal information by phone. Don't provide your Social Security number, your bank account information, your address, your age, some important information. And by securing your information, we're not only talking about you providing information verbally to people. A quick question. How many of you carry your Social Security card with you in your wallet? Okay, just answer that question to yourself. If somebody opened the mic, anybody, okay? The advice is, please, do not carry your Social Security card in your wallet. If you think about it, when was the last time that you used your Social Security card? When was the last time that somebody really asked you for a real reason? Can you show me your Social Security card? Probably you can even remember the last time that you actually used your card, because the card is not an identity document. Your card, people who will ask you for your card and have a valid reason to ask you for your card is you are buying a new house, or you are getting a new apartment. You are going to open a bank account. Those are some of the reasons. Or you're getting a new job. Those are the reasons. In most cases, you only need to know your Social Security number. So please do not carry your card with you, because if somebody steals your wallet, guess what? You're going to have at least your ID or driver's license there, right? A scammer has all the information they need. Your name, your address, date of birth, and your Social Security number. So please keep your Social Security card in a safe place where no one can get to it. And of course, try to remember where that place is, okay? Somebody told me the other day, I need a replacement card. And I said, you lost your card? And the person said, no, I know I have it at home. It's in a safe place, but I can't even remember what that is. So safe that it is even a safe that I cannot even remember when I put it. So please keep it in a safe place where you know where it is, please. If you suspect fraud, please contact the Office of Inspector General. That number is 1-800-269-0271 at the bottom of the screen. You can talk to our representative from 10 to 4 to file a report. You can also file a report online. If you visit us at ssa.gov, you can just go in the search and just type how to report fraud. You need to help us. If you are a victim of fraud, please need to help us, because the only way that, and we have different agencies working on fraud reports. We have Department of Justice, the local police, of course, the Federal Trade Commission, many agencies working together to put those scammers away from all of us, but we need your help. So please do those reports. In the next slide, there are a couple of other resources that I would like to provide to you. You can also try to register for the Do Not Call. The Office of Inspector General actually advises that if you receive a call, you take a look at your phone, and if you don't recognize the phone, you will be better off not to answer that call. If you receive many calls, unwanted and unsolicited calls, please register your phone numbers, your landline number, your cell phone numbers, your family cell phone numbers. Register them in the do not call.gov, or you can even call 888-328-1222. Once again, we have the Office for Inspector General, and something that is very important is about, information that we get. Most people that are being scammed are either people who are younger, but they have a disability, and most people are elderly, older Americans. So please help us deter this crime. You can contact the National Center for Elder Abuse, because this scam, yes, it's a financial exploitation, but also there are other types of abuse that are being committed to people who are older. So if you or somebody that you know is abused, please make those reports. Okay. Any questions on reporting responsibilities or scams? Anybody? Okay, let me check on the chat. I don't have any questions on the chat, or okay. Good, so let's continue then. Let's talk about working and receiving Social Security benefits. Remember that I said that if you are receiving Social Security benefits, yes, we allow you to work. Happens to be that depending on the type of benefits, you are only allowed to have a specific amount of money in the year when it comes to earnings. For example, for disability, it's a different amount. But when it comes to retirement benefits, if you're receiving retirement benefits and you are under your full retirement age, and full retirement age depends on the year that you were born, but it can be 66 or 67. If you are your full retirement age, there is no limit in the amount of earnings that you can have. You can continue working full-time if you would like, and your benefits will not be impacted. But if you're getting benefits under your full retirement age, then there is a small amount of earnings that you can have in the year. That amount for the year 2022 is $19,560. So you are 63 years old, receiving early retirement benefits, and you make $19,560. We're going to pay you your benefits every month. But if your earnings go above the limit of $19,560, then we are going to start deductions of your Social Security benefits. We are going to take $1 of benefits for every $2 that you go over the amount that we allow you. Let me give you an example. So in other words, if you have somebody that is making, let's say, $20,560. So we're going to say, well, you're going over the limit by 1,000, right? So we are going to not pay you $1 of Social Security benefits for every $2 you go over. So basically, $500 of benefit we will not pay to you. You will not be due because your earnings are above the limit by the amount of 1,000. Please be aware that these limits only pertain to earnings. You continue working for an employer, or you start doing self-employment. It's only related to earnings. You can have pensions, you can have all the sources of income, and will not be considered in this amount. It's just earnings. Now, the information you see in the middle, 51,960, is for somebody that is going to be full retirement age this year, but who wanted to get benefits from the beginning of the year. Well, from the beginning of the year, since the person is not yet full retirement age, there is still a limit, but the limit is higher. So that's the information you see in the middle. And if they go over the amount that we allow them, the deduction is less, because we only take $1 of benefits for every $3 they go over the amount that we allow. Okay? Any questions about working and receiving benefits? No, I will take that as a no. Okay, then let's continue. Now, what about taxes? Do people who receive Social Security benefits have to pay taxes? It depends. In the next slide, you will see who will have to pay taxes over Social Security benefits. And the beneficiaries that have to pay taxes are beneficiaries who will file an individual tax return of with more than $25,000, or for couples, more than $32,000. They have to pay taxes on some of the Social Security benefits. And in the next slide, you will see basically what is the formula. It's a very simple formula that they use to determine if your income is over 25, once again, for single taxpayers, or over 32,000 for couples. So in the next slide, please, you will see the formula. You will see that all of your income will be considered. If you're receiving a pension, if you have withdrawals of your 401k plan, if you have dividends, interest, capital gains, everything is going to be considered. And also an amount equal to 50% of your benefits. So in other words, if you're receiving $10,000 of Social Security benefits in the year, $5,000 will be considered in this formula to find out what is your combined income. And once again, if your combined income is more than $25,000 for single taxpayers, more than $32,000 for couples, then be prepared. You're going to have to pay taxes on some of your benefits. Okay. We always refer you, if you have any questions, to the IRS, because we are not experts. No Social Security employee knows about taxes. I don't know about my coworkers, but I don't know anything about taxes, to be honest with you. That's why we always refer you to the IRS, irs.gov, or you can give them a call at their toll-free number, and they can tell you, okay, if you're going to have to pay taxes on your benefits, what is the rate of taxes, and so on and so forth. Also, we provide this information because we want you to be ready. We don't want you to have any surprises when you're receiving your benefits. And we would like for you to know also that if you have to pay taxes on Social Security benefits, we can deduct those taxes from your benefit directly. So that way, like when you were working, you will pay those taxes along the way. Okay, but it's a personal decision. But please be aware that it is possible if you ask us that we will withhold taxes. Federal taxes only. We will not be able to withhold the state taxes, but we can withhold those federal taxes. On this section, as I said, I just would like to provide you with information. No questions because I don't know much about taxes, but we're going to talk about something that is very important, family benefits. let's talk about spouses. Somebody open a mic there? Somebody? Any question? No? 1, 2, 3. Okay. Let's continue then. Okay. As I was saying, family benefits. We're going to talk about family benefits, and I have a comparison chart here because most people tend to believe that we only pay benefits to family members when the worker is deceased, and that is not so. Of course, we pay benefits if the worker is deceased. We pay survivors benefits to family members, but we also pay benefits even if the worker is alive. The worker must be receiving either retirement or disability benefits for us to pay benefits to family members, but it is possible that we can pay benefits. So let's talk about family benefits. First, let's talk about benefits that we can pay to spouses of workers that are either retired, disabled, or deceased. Let's talk about first when the worker is alive. That is the column you see towards your left. When the worker is alive, if the worker is receiving retirement or disability benefits, we can pay benefits to spouses with child in care. And for Social Security, child in care is defined as the spouse is of any age but has a child under the age of 16, or a child that is an adult but is a disabled adult child. So we can pay benefits to spouses at any age. Of course, we pay benefits to spouses as early as the age of 62, but those benefits will be reduced. And of course, we pay benefits at full retirement age. How much can spouses get? An amount equal to 50% of the worker's full retirement age amount. And we're going to do some scenarios and some examples so you can really see how benefits for spouses work. But one thing that I can tell you ahead of time is that the benefits that we can pay to spouses will not impact the benefits to the worker. Those benefits that we pay to family members are in addition to the benefits that we pay to the worker. Okay, so we pay the worker first. And if the worker has spouses or children that can get benefits, they also get the benefits. Okay, now let's take a look at the column towards your right. That's survivors when the worker is deceased. Once again, we can pay benefit to a surviving spouse of any age if there is a child in care. And once again, child in care is defined by Social Security as a spouse that has a child on the age 16 or a child that is disabled at any age, of any age. For as long as the child became disabled before the age of 22, we can pay benefits, even if that is an adult child. 40 years old but became disabled before 22 or was born disabled, we can pay benefits to that spouse with child in care. But we also pay benefits at the age of 60 and even 50 if the widow or widower is also disabled. And take a look at the rate of benefits that we pay if the worker is deceased. It is certainly a much higher amount. We can pay 71.50% or even 100% to the surviving spouses. And there are different factors that we have to take into consideration to find out, you know, if we're going to pay 71.50 or 100. Some of those factors are, what is the age of the widow or widower? Certainly at full retirement age, we're going to pay the full amount. But we're also going to take a look if the worker filed for benefits early or at full retirement age, or even postpone benefits to the age of 70. So it is going to be different But on survivor's cases, we always pay a higher amount of benefits. Take a look at, the column that says for the spouses. We pay an amount equal to 50%. Now, besides the spouses, we can also pay benefits to divorced spouses. In the next slide, you will see what are the requirements for divorced spouses. And you will see that besides the divorced spouse being 62 years old, the requirement is that the divorced spouse was married to the worker for 10 years, is single at the time of application too. Okay? If that divorced spouse remarried, cannot apply for benefits on the worker's record as a divorced spouse for as long as it's remarried. And the benefits that we pay to a divorced spouse will not impact at all the benefits that we pay to a current spouse if the worker is remarried. So what I would like to do is do a summary of spousal benefits, give you some scenarios so you know how this works, because you might be wondering, well, I get benefits, or in the future I will get benefits. I'm married, my spouse actually works too. So am I getting the right amount of benefits, or will I get benefits on my record or my spouse's? I will get both. What's going to happen? What is Social Security going to do with my benefits and my spouse's benefits? Let's do a summary, and then we will stop for questions. So please be ready with your questions. In the next slide, let's talk about, once again, the amount of benefits that we can pay to spouses. It is an amount equal to 50% of the worker's full retirement age amount, and the worker must be receiving benefits. First, the worker must be receiving either retirement or disability benefits. So let me give you a scenario here, and we'll do an example also. In this scenario, we have a couple. Happen to be that one of the members of the couple did not work enough, does not qualify for Social Security benefits because did not work enough or never worked, maybe. Well, in this scenario, if we have the worker that is going to get $2,000 at full retirement age, remember, the rate of benefits for spouses is 50%, right? Well, 50% of 2,000 is 1,000. That stay-home spouse will get $1,000 in Social Security benefits. We will pay the worker $2,000, the stay-home spouse $1,000, total family benefit $3,000. Okay. Now, if that spouse files for benefit early, there will be a reduction. If you take a look at any Social Security benefits, if you file for benefits before your full retirement age, we are going to reduce your benefit amount. Okay? By how much? It is about 6% per year that you apply for benefits before your full retirement age. Okay? Now, let's move to the next bullet, number 4. No, can you go back? I'm sorry, please. The next bullet, where it says, if a spouse's own benefit is less than 50% of the workers, okay, the benefits will be combined. The benefits will be combined to equal 50% of the workers. So let me give you a scenario on this. Let's say that we have a couple, but in this scenario, both of them work. Both of them have their Social Security credits. Just happens to be that one of the spouses maybe only work part-time to spend more time with the family, right? So once again, let's say that the worker with a higher earnings record will get $2,000 of Social Security benefit on his or her own record. Now, for that spouse that work part-time only, well, if they had less earnings, we will pay less benefits because benefits are paid dependent on the contributions that you have. So let's say that that spouse that only work part-time can only get $500 on his or her own record. Well, we will say you can only get $500 because you had less earnings, but you are married to this worker that is getting $2,000 of full retirement age. Under your spouses, we can pay you $1,000. If I ask you the question, well, under your record, you can only get $500, but we can pay you $1,000 under your husband's record, your husband or your wife's record. What would you say to me? Can somebody type the answer? Would you rather have only $500 or $1,000? Anybody? You can send that in the chat if you don't want to open your mic. You would rather get 1,000? Yes, and that's what we will say to you. Thank you very much for answering. We will say you are eligible for benefits on your own record only 500, but on your spouses you're eligible for 1,000. We would rather pay you 1,000. So we will still pay you the 500 that you are due on your record and another 500 from your spouses to equal the higher amount. So once again, in this scenario, we will pay $2,000 to the worker, $1,000 for that stay-home spouse on a combined benefit, total family benefit $3,000. There is one more scenario that I would like to provide to you because certainly, probably that is the most common scenario in our country. Both the spouses work and both the spouses had about the same amount of earnings. What will be the best benefit for them? Let me give you this scenario. Actually, I'm going to use myself as an example. My husband and I work. We are about the same age. We had about the same amount of earnings. Let's say that he will get $2,000 of Social Security benefits on his record, and I will get $1,800 on my own record. What's the best benefit for us? Which one is higher? He will be better off to get benefits on his own record so he can get his $2,000. I will be better off to get benefits on my own record so I can get my $1,800. The total family benefit will be $3,800. Because if you take a look at it this way, if I am getting $1,800 on my own record, right? He's getting $2,000. So that only means that under his record as his spouse, I can only get $1,000. So why will I get only $1,000 if I can get $1,800 on my own, right? We will always make a comparison. And we do this when the worker is alive or the worker is deceased. Okay? We done this. If you're getting benefits, we done this comparison. In your record, your spouse's record. If you're not getting benefits, this is what we will do when you file, when your spouse files. Let me stop here. Anybody has any questions on family benefits, spouse's benefits so far? Because we have also some other benefits. Anybody? No? Okay. Let's talk about other benefits that we pay, okay? And we pay benefits to children, okay? But let me just do also in the next slide, please, Ms. Diaz. We have a summary of survivors' benefits, okay? Remember that I said that we pay benefits when the worker is alive, but we also pay benefits when the worker is deceased. And when the worker is deceased, we can pay benefits to children. All children under the age of 18 and single can get benefits from a parent's record. We even pay benefits between the ages of 18 and 19 if the child is still in high school and full-time attendance. And we pay benefits to adult children if they are disabled and became disabled before the age of 22. They can be 40 years old, and if they were born disabled or something happened and became disabled before the age of 22, we can pay benefits to those children. And once again, a little bit of summary on benefits for widows and widowers, including the divorced widow or widower. Once again, we can pay benefits at any age if there is a child in care, or even at 50 if they are disabled, or even 60 years old. And the next slide is a little bit of a summary, once again, for children. And it's the same requirement for children when the worker is alive or deceased. What is a little bit different is the rate of benefits. When the worker is alive, we're going to pay a child that is under the age of 16 or a child that is an adult but disabled adult child. We will pay an amount equal to 50% of the worker's full retirement age amount. If we have a worker that is getting $2,000 in benefits, a disabled adult child or a child under the age of 18 or a child between 18 and 19 is still in high school will get $1,000. When the worker is deceased, we actually pay 75%. Always higher rate of benefits if the worker is deceased. There is one more benefit in terms of survivors. We can pay benefits to the parents of the worker. If a worker was paying the financial support, was providing financial support to the parents, and that financial support is about 50%. And if the parents are at least 62, they can get benefits from a worker that is deceased. Okay? Any questions about survivors? Any questions about family benefits? What's the definition of disabled adult on Social Security? So once again, for the definition of disabled adult is a child that can be of any age but has a disability that started either at birth because the child was born disabled, or the disability started before the age of 22. Now, let's define what is disability for Social Security benefits. For Social Security, we consider a person is disabled, and an adult is, when the person has when the person is at least 18 years old. So if you have a person that is 18 years or older, but the person has a medical condition, and it can be any type of medical condition. It can be a physical impairment. Somebody had a car accident and somebody's paralyzed, right? It can be an emotional condition. The person suffers from anxiety, depression, and is unable to work because of that. Or it can even be a mental condition, somebody that is bipolar, schizophrenic, or has a psychotic. It's any type of medical conditions. But the medical condition stops the person from working. And even if the person is working but is unable to make more than certain amount, and that amount is $1,350 this year in the year 2022. And of course, this is a permanent condition that doesn't allow the person work in anything, basically. That is what we consider disability, having a medical condition that stops you from working or prevents you from working and making certain amount of, having certain amount of earnings. And of course, that the condition is permanent or it's going to last more than 12 months. So what kind of documentation is needed to show that they are disabled, especially when there is a mental condition? Well, the person must provide us with medical records, from a doctor's office that shows a diagnosis. If the person is actually taking any medications. We actually, I invite you to attend with us. We are going to have, the next program is going to be on retirement on Medicare, but the last program, we will be talking about disability. So please attend to the next program and the following two programs. We will talk a little bit more about disability, but basically, being disabled for Social Security Administration, the person must have a diagnosis, provide information about medications that they are taking, provide us with places where they have the names of doctors, for example, the places where the person has been hospitalized, if in any case. So all types of resources where we can gather medical evidence. If they have medical records, that is great, but we might still contact their doctors. Okay, so please stay tuned, okay? And I will answer any more questions if you have at the end. Now, if no one has any other questions, we're going to continue, and we're going to talk about Medicare, which is a very, very important benefit, because basically Medicare is the National Health Insurance Program given to people who are 65 years or older, but people at any age, if they are disabled and receiving disability benefits from Social Security, or they suffer from kidney failure and are on dialysis for 3 months. And Medicare is very comprehensive, but people under Medicare, you have options. You can enroll in a Medicare Advantage plan, or you can enroll in a Medicare Original plan. What's the difference between the two? The Medicare Original plan is divided in different parts. Oh, yes?
Yeah,
You have a question?
Yes, I'm sorry. Yes, I do. I was wondering, do you have information for someone who was never married and single, and how the thought process of how to decide when, because you can get it, I know you can get it at 62, or then you can wait.
Correct.
Up until 69 or 70, but how do you, is it only the money or that makes you decide to base your decision on, or if you get it early, does it increase to the full when you're old enough, or how does that part work for single people, never married?
Sure, okay, and thank you very much for the question. And what I can tell you briefly is that for a person to decide when to start collecting Social Security benefits, you mentioned it's not just about the amount of benefits that the person will receive. Okay. Many other factors what will allow, taking into consideration many factors, is what will allow the person to make the best decision. You have to consider factors such as, yes, how much you're going to get in benefits, but also what other incomes you will be receiving on retirement, and what are your financial responsibilities. You have to consider factors such as, hey, will I have to continue working a little to supplement my income? Will I have to, do I have other pensions? How is my health? Health is a very important factor, because certainly we do have some workers that at the age of 62, they are already undergoing a medical condition. Are you still working? Do you enjoy what you do? Those are some of the factors. Family issues might be a factor as well. Are there members of your family that can receive benefits? Or you might be forced to start getting benefits, to stay home to take care of a loved one. Many factors that you have to consider. For now, I invite you to visit us online at ssa.gov. And as soon as you enter the home page, you can actually click on the menu and select frequently asked questions.
Okay.
Under the frequently asked questions, then in the next screen, you will have like a tile, different tiles. One of them is retirement. If you click on retirement, you will have a lot of information and publications available to you. So you can start answering some of these questions that you have. But most of all, I invite you to attend the next program on March 26th. Let me just double check on that day, please. March 26th, because we are going to be talking specifically about how to find out when is the best time for me to retire. So I will be providing all that information. Let me double check on the date. Yes, March 26th. So please mark your calendar. Okay, March 26th, we will be talking about retirement, Medicare for people that are not getting benefits yet. Okay, but so far, try to visit us online and get some of that information. Okay, we will be talking more about that. And if you have any more questions, I can answer those at the end of today's program as well.
Thank you.
Okay, so let's talk about Medicare once again. Okay, I was talking about the two options that people have when they enroll in Medicare, when they are eligible for Medicare. And under the Medicare original plan, that is divided in different parts. Part A is for hospitalization. You do not have to pay any premiums for the Part A for as long as you have your 40 work credits. Now, Part B is the medical, outpatient services. For that part, you have to pay a premium. And the premium this year is $170 with 10 cents. That premium is paid on a monthly basis per person. And the Part B covers, outpatient services, mostly outpatient services. And under the original plan, you can also select the option of a prescription plan. The prescription plans are private companies contracted by Medicare, and premiums deductibles are different. It depends on the plan that you select. But under the original plan, you can enroll in all of the parts, so you can select to enroll in one of the parts only, get other parts for later. If you are still working at the age of 65 and you have health insurance based on your current and active employment. Under the original plan, like any other health insurance, there are premiums, deductibles, and copays that are your responsibility. And that is the reason why some people, get a Medicare supplemental insurance under what we call a Medicare policy. Now, under the Medicare Advantage plan, these are actually private companies contracted by Medicare, and most plans are low cost, a lot of them HMOs, and some of them provide additional coverage for vision, dental, and hearing, which the Medicare original plan does not cover. So, and the last question was, how to make decisions about retirement. Well, you also have to make decisions about Medicare. So it's important that you know the basic information and also know resources who can help you make those decisions, okay? Under Medicare, the original plan, I told you that the premium for the Part B is $170 with 10 cents, but people with higher incomes will pay a higher Medicare premium. Now, we encourage you to actually create an account and to visit the Medicare website, because they have the publication in which you will be able to find the correct amounts on those Medicare higher premiums for people with higher incomes, and also the specific coverage on each of the parts of Medicare. On the Part A and B, you will also be able to find information about if you are going to get a Medicare prescription plan. You will find information if you select the book, Medicare and You, that is for your state. You will see which plans are available for you in your state. If you realize that you will be better off under a Medicare Advantage plan, that booklet, Medicare and You, if you select the one, once again, for your state, will give you the information for your state. Remember that those are private companies, the Medicare Advantage plans and the prescription plans, so the plans are different from state to state. So please visit the Medicare.gov website, and also you can create a Medicare online account, so that way you manage your benefits that way, your Medicare benefits. In the next slide, since Medicare has a cost, the prescription plan, you have to pay a separate premium, and also you have to not just pay a premium, but deductibles and copays. It is also true with the prescription and the Medicare Part B. Know that if your income and resources are under certain threshold, Social Security has extra help. You can apply for extra help with Social Security to assist you with the payments of the premiums, deductibles, and copays of the prescription drug plan. And with the state, you can get assistance to pay for the Part B premium. I have a question here. I remember a lot of controversy about the donut. What is the donut? Basically, on the Medicare prescription plan, there is, all of the plans are the same, basically the same. There is actually certain amount of benefits that you can get, and if you reach certain threshold, then you will be responsible for the entire payment of your prescriptions, up to certain amount once again, and after that, Medicare will start covering you again. That is basically the same for all of the plans. That is why it's called the donut hole, because, Medicare starts covering you, then there is a certain amount that they will not cover for you anymore, that you will be basically in that middle of that donut hole, and then they will start. And since Medicare prescription plans are different because they are private companies, the thresholds are different for each plan. Okay, so that is why it's so important to get the information ahead of time to make the right decision. If you have to be in a Medicare Advantage plan or a Medicare prescription plan, if you think the Advantage plan will be better, you will be better off than are just, and there are resources that can help you, and I will provide those in a few, but there are resources that can help you make those decisions. Okay, the best thing is to get information ahead of time, to take a look and apply that general information to your personal situation, so you will really make the best decision. Okay, so in the next slide, I would like to provide you with information about what are the thresholds of income for people who will qualify for extra help. And as you can see, in terms of the individuals, the income is $19,320, and the resource limit is $15,510. And when we talk about income, we're talking about money, the money that people receive, either is your benefits, your pensions, any capital gains, any dividends that you receive. And of course, the resource is what people own. Do you have a bank account? How much do you have in your bank account? Do you have other, like certificates of deposit, for example, or promissory notes. Okay, that is what is considered a resource, the things that you own. Now, you can see also what are the resource and income limits for couples to be eligible for low income subsidy limit. The income limit for couples is $26,130, and the resource is $30,950. And those amounts are for the year 2022. So if you receive Social Security benefits and you are on Medicare already, you have a prescription plan with Medicare, then if you have income and resources under this limit, either you're an individual or couple, please contact us. You can actually complete an application for extra help online, but if not, once again, you can just give us a call and our representatives will be able to send those the forms for you to complete. And also note that if you qualify for extra help, you will also qualify for the state under the Medicaid program to help you with the payments of Medicare Part B premiums. Okay, and I have a couple of resources for you in the next slide. As a matter of fact, you can actually contact your local social services office if you only receive Social Security, or sometimes even if you receive a pension, but your pension and your Social Security benefits are low. Chances are that you might qualify for all the benefits with Department of Social Services, and we encourage you to call them. If you need assistance with making decisions on Medicare, what's the best option for you? Are you better off in the Medicare Original Plan, or you will be better off on the Medicare Advantage Plan? If you need to select a Medicare Prescription Plan, which plan of the many available in your area will be the best for you? Well, contact the state health insurance program, because they have representatives trained by Medicare to help you make those decisions. You can either visit them online at chiptacenter.org or give them a call. That number, 1-800-243-3425 for Maryland residents. If you live in the District of Columbia, or if you live in Virginia or have family members who live in those jurisdictions, still call that number or visit online so you can get the information for the state where you live in. Okay? Any questions about Medicare, please? Any questions? You can send it through the chat, or you can unmute yourself. No questions? Okay. One last thing that I want to discuss with you is the amount of benefits that people receive from Social Security. Because sometimes, just yesterday I was on a call assistant, a beneficiary, and she was telling me, the amount of benefits that I get is very low. I worked for many, many years here. Why is that? Well, in the next slide, you will see basically what is the formula that we use to calculate Social Security benefits. And these are actually the first three steps that we use. First of all, we are going to look at your entire earnings record. From that very first summer that you worked when you were still in high school until the year before you file for benefits. We will look at every single year of earnings, and we will increase those earnings to current value. So what you will see in the calculation of your benefits will not see what you actually make, but what those earnings are worth in today's dollars. And then we are going to select 35 years. We're going to use the higher years of earnings. whether they are at the end of your career, at the beginning, in the middle, it doesn't matter. We will find you higher 35 years, and then we will make an average of earnings. We apply a formula, and that's how, in a nutshell, how we calculate your benefits. I can tell you the benefits for all of us who are getting benefits is different, and for all of us who will be one day receiving benefits will be different. Because for each worker, the benefits are based on the number of years the worker contributed in the system, the amount of those earnings over those years, and then the age in which the worker gets the benefit. Those are the three factors, and they are all going to be different for all of us. So when you take a look at your earnings, please make sure that your earnings are correct. If you're not getting benefits yet, make sure that your earnings are correct, because those earnings not only give you eligibility to benefits, but that's what we use to calculate your benefits. So workers that have lower earnings and work less years than 35 will have the end result, which will be a small benefit, a small amount of benefit. Worker with higher earnings, the higher your earnings, the more that you work, the more number of years you work, the later that you delay your benefit is what is going to give you a greater return on those benefits when you start collecting them. Okay, what is the highest benefit possible? In the year 2022, a worker that actually contributed into the Social Security system for the higher amount of Social Security benefits, the higher benefit this year is $3,345. But that is the average, the higher average of benefits. But what is really important for each one of us is how much I will get in benefits. So if you're not getting Social Security benefits, I encourage you once again to please create your online account so you can get information on how much you will get depending on your earnings history, depending on the years that you contributed. And it will give you the different options that you have in regards to those benefits, okay? Next slide, very briefly, is designation of representative payee. After March 2020, for all new claims, we are asking applicants to give us advanced designation of representative payee. A representative payee is a person that is going to manage Social Security benefits for a person that is a child under the age of 18 or even an adult over the age of 18, but is an adult that is incapable to handle his or her own benefits. So we request this because from time to time, for example, on retirement, somebody starts receiving retirement and the person gets older, the person gets to a point that, gets dementia or any other medical conditions that doesn't allow the person to manage their own benefits. So we need to have a representative. And when we have that advanced designation, it is better because then we have a pool of at least 3 people that can become the representative if the case comes. We also need representative advanced designation for people that are applying for disability benefits in case their medical conditions are severe and they cannot manage the benefits. And of course for children. Okay, so please let us know if you're going to file for benefits for the first time. You're going to have to give us this information ahead of time. Next slide, and then we will open up for questions. I see that I do have one other question in the chat. So please contact us, okay, if you have any questions. We not only have the publications and benefit planners, calculators, and all the great information that we have available online, but we also are in social media. We are in Facebook, Twitter, Instagram. We have a blog and also a newsletter that you can register, and you will receive, information from Social Security. We have a new commissioner, so you need to be abreast of what his vision is, how she is going to lead our agency. It's just an acting commissioner right now, but, she might become the permanent commissioner for the Social Security Administration. So please contact us, visit us online, SSA.gov. If you're a friend of us, in Facebook, if you are in Facebook, if you are a friend of us in Facebook, you can send us questions that we will answer like a good friend. We are also in Twitter, so you can share and retweet good information that we provide to you. You can retweet to your loved ones, family, and friends. Visit us online. Remember that Social Security is with you through your life's journey. Once a Social Security number is assigned to a baby in a hospital until, your days in retirement. So please get to know us better. And I'm going to stop. I'm going to start answering more questions. And I have one question. Can you contribute more to Social Security? I can tell you that the only way that you can contribute into the Social Security system is by working. So yes, you can contribute more if you start working more, okay, having more earnings. That is the only way to contribute into the Social Security system, working, either if you work in self-employment or you work in regular employment. The most important part of it is that you work, you pay your taxes, you file your income tax return. That's the way to contribute into the system. Okay, anybody, any questions about anything we covered so far or any other questions that I can answer? And please, before you disconnect from this program, attend the next two. We are going to have one program on March 26th, 10 a.m. in English and 1 p.m. in Spanish, so you can invite all of your friends. On March 26th, I will be talking about retirement and Medicare for people who have not filed for any benefits yet. So please come back, invite all of your friends, and I'm looking at my calendar. On April the 9th, we will be talking about disability benefits. So please attend the next two sessions because it will be different information that you can use to make decisions about your benefits. But if not, information that you can use to help a family member or even a friend in your community. So I'm ready to answer those questions. Somebody says here, Melissa, unfortunately, I will not be able to attend the next two. How do we get access to the recording? I will defer to either Ms. Diaz or Ms. Ellis, please. If we can answer Melissa's question, that will be awesome. Anybody has any questions? You can unmute yourself while we...
Yep. Yeah, can you hear me? Yeah, I can. Yes. So the recording will be posted on Monday. And if we can get your emails, or if we already have your emails, we'll just send them to those emails in a form of a link.
Oh, if I can answer that for the next two I think Miss Melissa was asking about the next 2 sessions. We'll have a recording, and Miss Diaz will or the communications will email that to them.
Great. Thank you. Thank you very much for providing that information. Any other questions that I can answer, please? You can either unmute yourself or you can send me the question through the chat. Can you contribute more to Social Security? Once again, you know, as I said before, the only way to contribute into the Social Security system is by working. You earn your credits, and you also, you know, get your earnings record by working, having those earnings. And there is another. Is there a maximum that you can contribute annually? Once again, it is like a maximum amount of Social Security earnings. Okay, a maximum amount of Social Security earnings, meaning that if you make in the year 2022, the maximum amount of Social Security earnings is $147,000. So if you make up to that amount, you're going to pay Social Security taxes up to that amount. And all of those contributions are going to be used in the calculation of the benefits when you file to get benefits. And if you remember that I said the maximum amount of Social Security benefits this year is $3,345, that's for a person that contributed up to the maximum amount of Social Security earnings in their entire working life. So how does it work for self-employed individuals? If you work in self-employment, actually what goes into your earnings record is the self-net of the earnings that you have in self-employment. Self-employment net earnings. The amount that appears on your SE schedule, the self-employment schedule in your income tax return, the line that says net, you know, self-employment net earnings, that's the amount that appears on your Social Security. It is not the amount that you receive in income. Because remember that in self-employment, some of you might have to apply deductions of your self-employment. So after all of that deductions, you are left with their net earnings, self-employment net earnings, and that's the amount. So I invite you to take a look at your Social Security statement, to create your online account. First of all, to make sure that your employment net earnings are higher than certain thresholds that will allow us to post that information. Make sure that you have all your credits. And that is basically the only way to contribute into the system, by working either in regular employment or self-employment. You want to make sure that you're getting all those credits, that your income tax is filed correctly. Any other questions? For those of you who have friends that speak Spanish, okay, we will be conducting the same seminar today starting at 1 p.m. So today at 1 p.m., we do the same seminar but in Spanish. So please invite your friends and family members if you have any, okay? Anybody, any questions, please?
Will this be posted for community members who maybe don't have email, didn't know this was occurring? You know, will it be posted on the Mount Rainier Facebook page or on the website for community members to access?
Yes, it will be posted in Facebook, definitely on Monday.
Great, thank you.
You're welcome. Well, if you don't have any more questions, thank you, Ms. Varela, and I will see you at 1 p.m.
Thank you so much, Ms. Diaz, once again, okay, for inviting me. Thank you for reaching out to us. It's been a pleasure working with you. And thank you very much, those of you who attended the program. And as Ms. Diaz said, we'll see you at 1. For those of you who would like to attend, we will do the same program in Spanish. But please tell your friends and family members who speak Spanish that we have in this program, and also invite them for the ones that we will have on March 26th and April 9th. Thank you. See you soon.
See you soon.
Thank you.